Welcome back to Atlanta & Company. I'm Holly Furfer. We would like to once again welcome back our resident psychiatrist, Dr. John Carman of Carman Research. And as we mentioned before, Dr. Carman is the medical director of Carman Research. And what they do is they work with major pharmaceutical companies in testing the effectiveness and safety of investigational medications. And today, Dr. Carman will be discussing bipolar depression versus unipolar depression. Welcome back.
Hi.
First of all, describe to us what exactly bipolar depression is and unipolar depression.
Yeah. Certainly the major discriminating characteristic of the two illnesses is that, first of all, unipolar depression is much more common. It's probably about 16% of the general population lifetime prevalence. So in other words, chances are about 1 in 6 people will at some point in their life have an episode of it. Bipolar disorder and bipolar depression is probably a lot less frequent, about 1/6 or 1/8 of that incidence, but it is one that is often in many ways more destructive and more toxic to the people that suffer from it.
What are the characteristics of each, of bipolar and unipolar?
Right. Both tend to be episodic illnesses. That's one thing they have in common, but one thing that's different about bipolar disorder is that it tends to be cyclic, that it tends to be more uniformly episodic, that the interval between, say, high periods and low periods may be really fairly regular for a patient once you get to know the patient's history and you're really sure that you're not mistaking some of the episodes for periods of alcoholic relapse or drug abuse, and you really start to plot out a life chart on a patient. You realize that these people have had fairly routine springtime or every 42 days or some regular incidents to their onsets of the depression. But there are certainly symptom differences between the two types of depression.
What would the symptoms of bipolar be and the symptoms of unipolar depression be?
Yeah, I got some bullet points.
Yeah, I think we just saw them. Maybe we can see them again. No, that's okay. We're learning about it. So what would bipolar depression, there we go.
Yeah, the unipolar depression typically has decreased or interrupted sleep. It's a very prominent characteristic. Classically, waking up in the middle of the night, can't get back to sleep. Bipolar depressives may sleep 12 to 14 hours a night and not feel rested when they get up. In many ways, the sleep and some of the activity parameters are just the opposite of what a bipolar patient experiences when they're at the other extreme of their bipolar illness, which is mania. They get very active and require virtually no sleep without any fatigue when they're manic. When they're depressed, they require tremendous amounts of sleep and never really feel rested. They feel sluggish, their speech is slowed, whereas unipolar depressives frequently sound more agitated when they're depressed. There are other differences as well. I think one of the things that we speculated about years ago, and I think there's a tendency now in the basic science research in bipolar illness to come back to that idea, is that bipolar disorder may in fact represent a vestigial behavior similar to what we have as an appendix. An appendix is a vestigial part of our GI tract that mammals inherit from earlier days when they were maybe ruminants and required that little crop or gizzard or whatever it is. But the reason we still have that little thing that just gets us in trouble is that it's part of our genetic makeup that is maybe suppressed in most people or not large enough to cause problems. I think similarly, hibernation is a very useful survival tactic in people, in animals rather, that live in northern climates where the winters are extreme, where the ability to find food may be few and far between during the cold months, and so they've learned to slow their metabolism down and go to sleep. And in many ways, bipolar depression has the quality of that. And you wonder whether, in fact, what you're seeing in the mania is that frantic scrambling, looking for food that you see in hibernant species right before they go to sleep for the winter.
So there may have been a reason years gone by.
Yeah, and there may just be a reemergence of a vestigial behavior.
How do you test for this? I mean, is there a way to find out if you suffer from bipolar disorder or if unipolar disorder?
There are a number of things, but certainly the clinical presentation is the biggest thing. Looking for alternating episodes of high and low in behavior and mood, and the two illnesses really respond quite differently to medication, and that's something we've kind of reacquainted ourselves with in the last few years too. I think at one point we were taught to never put people with bipolar disorder on some of the older antidepressants, and that their mood in fact responded much better to lithium or to, as they became available, other mood stabilizers like Depakote and et cetera. And what we're seeing now is a kind of a rediscovery of that this is very, very important, because in fact there was a recent extensive trial done that showed that antidepressant effect of the standard antidepressants is negligible in people with bipolar depression. They really need to be on something on the order of lithium or a mood stabilizer, plus perhaps something more activating, but not necessarily an antidepressant.
If somebody wants to get involved in testing and maybe treatment at Carman Research, how do they get involved?
We have about 6 current major depression, unipolar depression studies. We have 3 current bipolar depression studies. We're doing a lot of work in both areas, and we always say that the difference between a brilliant idea in research and an effective new treatment is patient volunteers. We really need patient volunteers, and the programs we do are all completely free. All they do is call our number or contact our website, and at either end of that they can do a screening test which will qualify them for coming in for a free visit, and throughout their treatment with us everything is completely free, and they get a small travel stipend as well to make it easier to get to us.
Terrific. That's good to know. And I know that we have a question from someone who visited your website, AskDrCarman.com. So I'd like to read it quickly before we run out of time. This one says, I have been on a number of treatments for depression in the past. None have given me satisfactory relief. When I went off the medication, I had periods where I felt hopeful and enthusiastic. Is it possible I might suffer with bipolar depression as opposed to depression? What do we think about that? I mean, is that a possibility?
Yeah, I think that definitely could be. And a person who presents that history and who has not responded terribly well to standard antidepressants, and who has the history of having maybe mild euphoria or at least a very positive, aggressive, energetic behavior during periods when they're not necessarily on antidepressant medication, may very well have what they call bipolar II disorder, which is a milder form of mania or hypomania, added to occasional contrapuntal sort of episodes of depression. And so yes, that very well could be the history of somebody that is a bipolar II as opposed to a unipolar depression.
And that's something, if they came into Carman Research, they would be able to determine if it was bipolar, unipolar, or bipolar II.
Well, we spend a lot of time on accurately diagnosing people for a research study, because it's really much more necessary in a research facility to make sure we have an accurate diagnosis at the onset.
And working on new treatments with them as well.
Right.
Okay, thank you so much. We appreciate you being here again. Great, useful information. I know a lot of people can use the help you're offering. And if you want more information about Dr. John Carman and the Carman Research, just call 770-333-0093, or you can visit carmanresearch.com. And you can also send your questions to AskDrCarman.com. This segment was paid for by C&M Marketing. Okay, later on Atlanta & Company, Kira Sedgwick is opening